Welcome to my world once more. I invite you to another round of knowledge acquisition. This time around, I shall be taking you on a journey that I'm not so good or specialized on, but it is an aspect of medical laboratory science, and it is in the field of hematology. Hematology studies the blood in all its ramifications. And the area I shall be speaking on, the topic, blood coagulation knowledge. Blood coagulation knowledge. Ordinarily, when you see blood, it's either you are lucky to see it in a bottle, in liquid form. Anytime you see blood outside that is in the liquid form, it means it has something called anticoagulant, because blood, once it touches the outside surface, it starts clotting. So this ability to clot is a process that is used to stop bleeding. That is, once blood is exposed outside, that there is a bleeding, the first thing that happens is that the platelet component inside the blood will now come around, stick around, they form a clump, they block the blood flow, and the various coagulation plasma factors will now come together to form fibrin that will permanently seal the bleeding, so that the person will not bleed to death. So that is why you cannot see blood except it contains anticoagulants outside the body, still in the liquid form. It must always be clotted. When you see blood, whether it's on the floor, if it's not dry, it will clump. That is what is called coagulation. The knowledge of coagulation is very essential as we even grow old in age, because majority of people start suffering from blood coagulation disorder as the age is it's even the #1 risk factor when you are talking of coagulation disorder or coagulation problem. The problem associated with that is, once the blood should clot intrinsically, that is internally, then it could block the flow of blood to that organ that needs it. And if peradventure is the brain that the clot blocks the flow of blood, automatically the person suffers strokes, because there is no oxygen going that way and there is no nutrient. So the brain cells gradually dies. Messages cannot be transferred. The problem is what you now call stroke, whether it's partial, when it is not partial totally, gradually it's death. I would said that this much. Coagulation is not necessarily a problem if it's normal. It follows the standard procedure. But it becomes a problem when you start having problems of the blood vessels having fats, and the blood that should ordinarily pass through are now being disturbed, now experiencing a kind of starting the process of coagulating. So once that process starts, the blood clot is usually a problem around the legs. So you see it more often with legs that are red, or elbows that as displayed on my thumbnail, and that redness is a show of hematoma. That is, there's a blood clot around that area. But how do we solve this blood clot? You find people being advised at times to take aspirin, warfarin, and co, so that as one age you want to minimize. But that too has its problem because it's a thinning factor. It makes the blood thin and cause other complications. Like I said, this coagulation disorder is a specialist field, the hematologist, of which, like as a medical laboratory scientist, you are supposed to have knowledge in almost all these things, but you have to specialize. I'm not a specialist in hematology, but I shall try as much as possible to impart knowledge, and that will be easily done when I move on to the slide stage. If you like the presentation so far, click the like button. If you also want to subscribe, press the subscription. There is no premium attached to subscription. Press the notification, yes, so that you can always be notified when this production comes out. The various experience of blood clots can happen in all the vessels. The vessels of the body, you have the arteries, you have the veins, and you have their location where they have the capillaries. But when there is a serious problem is when the blood clot is around the heart or the brain. That's when it is seriously causing that stroke. But other problems that you can find associated with this are the redness, the pains experienced, the shoulder brain, because when blood doesn't flow, you find numbness. The part that the blood is not flowing through, it's numb. It's as if there is no feeling at all. If you even want to lift it, it's as if it's a dead part. So blood is very essential to the body, and coagulation knowledge is also very good as we age, because, like I said, the causes of the risk factor, especially of blood coagulation disorder, age is widely indicated, and the causes are almost many, like obesity, sedentary life, stuff like that will normally cause. But I will make things, I will really expose it in the slide that follows. As we now move into the slide section, I will be able to explain more. Blood coagulation knowledge. The definition. Blood coagulation disorder could be better understood as blood clotting disorder, which is the problem of blood clotting in vivo. When we say in vivo, we are saying inside, the inside itself. Coagulation test helps to assess the risk of excess bleeding or forming clots, thrombosis somewhere in the blood vessels. The clot moves from one area to the other. That is the problem with blood clots. And wherever it goes, it shows with symptoms, and the symptoms you get to know it as I expose. The causes of blood clot is, one is immobility or lack of movement, where you are seated for a long time in the same position. A disease or injury, like the COVID-19, yes, it really causes this coagulation disorder, injury to the area where the clot forms. The other thing that we must know is this coagulation disorder is serious, especially in a broken bone with obesity. Obesity, I have explained earlier how the vessels are really containing lipids, fatty substances which can help start the process of coagulation. The autoimmune disorder and medication like birth control pills that really predispose them. The risk factor essentially is age, especially if one is above 60 or 65 years old. You start experiencing this clotting problem. Sedentary life, like has been mentioned earlier, or journey that makes one sit for more than 4 hours, especially flights. Obesity, I've mentioned it, is a risk factor because it's predisposes one to this clotting. Pregnancy, you can see the positioning of the tummy and the baby. A family history of blood clots, smoking, cancer. These are all things that could be regarded as a risk factor. Children and blood clot. Generally, we want to believe it's adult problem, but children who are in the hospital have more of this experience. 1 in 200, according to CDC, hospitalized children can get blood clots. Causes of blood clot in children are reduced blood flow, damages to vein from intravenous catheter, genetic thrombophilia, abnormal blood vessel structure, May Turner syndrome, Paget-Reiter syndrome. All these predisposes the children to this clotting and experiencing serious problem. Pulmonary embolism symptoms, when the clot travels to the lung, you have this sudden experience of shortness of breath, by not because you're exercising, chest pain, palpitation, or rapid heartbeats. The same thing, symptom of stroke is very common. The clot moves to the brain. You have paralysis, numbness of the weakness of the arm, feet, trouble speaking, slow speech, confusion or lack of responsiveness, vision problem, trouble walking, and common problems you see. The symptom for when the clot moves to the heart, coronary artery thrombosis, there is that same chest pain, lightheadedness, shortness of breath, pain in the arm, neck, back, jaw, sweating, profuse, nausea and heartburn, raising heart. That is palpitation as well. Symptom of blood clot, which this is very common, with the lower leg, swelling, pains, tenderness, a warm sensation, reddish discoloration. Your symptom depends on the size of the clot. If the clot is very large, then the entire leg could become swollen. These are facts gotten from healthline.com. The diagnosis, ultrasound helps to really diagnose with image of the artery or vein where the blood clot is. The laboratory diagnosis, you can use the hemoglobin test to know the predisposition, and the complete blood count will always help us know the situation of the especially when you do film reading. The platelet count, once it's reduced, it's also created coagulation problem. Bleeding time, we usually do it by rubbing the ear those days and pricking it. Then you use the filter paper to be mopping it every 30 seconds until when there is no blood dropping anymore. These days you use pressure cuff on the forearms, and then you make a scratch and you start doing the same mopping the blood as it comes out. The Prothrombin time is very useful, though it does not really confirm hemophilia, because Prothrombin time will not detect the hemophilia problem of lack of factor 8, because hemophilia A lacks A has factor 8, hemophilia B lacks factor 9. The factor V assay too could be done, and the fibrinogen level, thrombin time, the one that will really help to detect it